Dr. Towers, we're using a sort of public health approach in this project that looks at violence as a contagion. Can you talk about how your data or the data that you've been looking at sort of reflects that notion that there's a similarity between the way a disease would spread and the way that violent extremism would spread? What makes it look like a public health issue as opposed to just a moral issue or a political issue?
Anytime you have people who are getting hurt, that's a public health issue. And so if you have partisanship reaching the point where there is very real danger that not just a couple people will get hurt, but lots of people will get hurt, that is a public health issue, and it's something that needs to be addressed. As far as violence and contagion, there's been lots of studies that have looked at kind of the multifaceted way that the contagion of violence spreads in a population. And as I mentioned before, there are these different forms of violence that your exposure to them can make you more susceptible to other forms of violence. And so one of the things that we did find in the Pacific Northwest was that right-wing extremists appear to come from counties that have higher per capita social services, things like domestic violence shelters, adoption shelters, things that basically indicate that perhaps there's more problems associated with kind of the violence within the family unit than you would expect in an equivalent county elsewhere. And so that suggests that some of these people perhaps are getting set up for but by exposure in their early childhood to violence, to basically reacting more angrily and more violently than they perhaps would otherwise to stressors in their life that come as they enter adulthood. So this is something that will require, again, like people like you and me and legions more, to study more the intricate, life cycle of how these kinds of violent extremism, both the left and the right, by the way, it's not just the right, how they come to be. Because as I mentioned before, it's not just like suddenly somebody decides on the spur of the moment, I'm going to go out and I'm going to beat up protesters, counter protesters at some protest. I'm going to. What brings you to that point where you're actually acting violently at a protest is a long life journey that brought you to that point. And we really need to put a lot more work into understanding what that long life journey is and where best we can put our resources into intervening in that cycle. So the example I like to give, again, going back to COVID, is if you only focus on what we call end-stage intervention measures. So for COVID, an end-stage intervention measure would be the person is coughing, they're sick, and the only intervention measure you do to try to stop the spread of disease is maybe ask that person to stay home. It's not nearly as good as if everybody was masking to make sure that they're not exposed in the first place, to be vaccinated for it, so that even if you are exposed, you're less likely to catch. And even if you do catch it, you're going to catch a milder case of it. So those earlier stage intervention measures for basically all diseases, earlier stage intervention measures are where your best ROI is. And unfortunately, when it comes to violent extremism, really the almost sole focus has been on end stage intervention measures. And by that, I mean law enforcement. And so by the time you've gotten to the law enforcement part of the thing, that person has been coming through this years-long cycle that's brought them to that point where they're acting violently. And they've already acted violently. And so in that sense have become contagious themselves in inciting others to act violently. And so if the only intervention measure you use is an end stage intervention measure like law enforcement, you are really not going to have a very good ROI on that. And that's why projects like ours, this project that we're working on, is so incredibly important, where we're trying to look at what are the community risk factors that are really fomenting this kind of anger, violent anger within them, and how can we partner with community groups and other stakeholders on the ground to try to reach people before they get to the point where they're so angry that they are willing to act out violently. So not trying to change their opinions, not trying to change anybody's political opinions, but just trying to dial it back a bit so that they are able to express themselves peacefully rather than violently.